Namaste everyone, welcome back to my channel Physio Vitals. I am Dr. Ankita Sawan and today I am back with rheumatoid arthritis. So we'll dive into the rheumatoid arthritis. So it is also known as RA in short form. So RA affects millions worldwide, and if you are interested in understanding how it impacts the body, how it's assessed and treated, and especially how physiotherapy can play a key role in managing it, then stick around. So rheumatoid arthritis is a chronic autoimmune disease that primarily affects the joints. The immune system mistakenly attacks its lining of the joints, causing inflammation and pain. So, to start off, what exactly is rheumatoid arthritis? Unlikely osteoarthritis, which results from wear and tear, rheumatoid arthritis is an autoimmune disease. This means the body's immune system mistakenly attacks its own tissues, particularly the joints. This can lead to pain, swelling, stiffness, and even deformity in severe cases. Moving further to the physiology. So let's talk about the basis of the physiology. In a healthy immune system, white blood cells attack the foreign invaders. For example, if a person is having any infection, that means some foreign invader has come into the body and the white blood cells are attacking. So that is the healthy immune response. Okay. So the white blood cells attack the foreign invaders like bacteria or the viruses. But in rheumatoid arthritis, the immune system starts targeting the synovium, which is the lining of the membranes that surrounds our joint. So joints are surrounded by the synovium, and the RA and the immune system. In RA, the immune system starts targeting the synovium, which is surrounded to our joints. So over time, this immune response leads to inflammation of the joints, which causes the symptoms of rheumatoid arthritis. Okay, so we just talked about the synovium, then where it is situated, the immune response we saw, and how it affects the joint structure. Okay, now, so here's where things get more specific with the pathophysiology. In rheumatoid arthritis, the immune response releases inflammatory chemicals called the cytokines. So these cytokines, the tumor necrosis factor alpha, TNF alpha, the interleukin 1 and interleukin 6 leads to inflammation of the synovium. So these cytokines which I just mentioned, the TNF alpha, interleukin 1 and interleukin 6, that leads to inflammation of the synovium. So this inflamed synovium, eventually it thickens, forming what's known as a pannus, and which is an abnormal layer of the tissue. So inflammation of the synovium, it thickens, from then it forms, it is known as forms what is known as the pannus. Pannus is the abnormal layering of the tissues. So this tissue then erodes cartilage and the bone within the joint, which leads to pain and the characteristic deformity which is associated with rheumatoid arthritis. So the autoimmune response, the immune system mistakenly identifies the synovium as a foreign target. Joint destruction, the inflammation which leads to the immune response is attacking, inflammation is causing, the immune cells attack the synovium, causes the inflammation and release of cytokines. Then joint destruction, the chronic inflammation which leads to damage of the cartilage, bone erosion and joint deformity. Now, to better understand how rheumatoid arthritis impacts the body, let's take a look at the anatomy. Rheumatoid arthritis can affect many joints, but it's most commonly seen in the hands, wrist and the knees. Spine and hip is also common, but these three are the severely affected joints. So these are synovial joints, which I just mentioned, the hand, wrist and the knee. The synovial joints, meaning they contain a fluid filled capsule that allows smooth, pain-free movement. In rheumatoid arthritis, the inflammation damages the synovial lining, which reduces the joint's ability to move freely and comfortably. So the joint is impacted here, mainly the wrist, finger, pain, stiffness, decreased range of motion. In fingers there will be swelling, deformities and difficulty with fine motor skills. In knee, pain, swelling, instability will be there, and in feet there will be pain, stiffness and deformity affecting walking. Now, how to assess? So how do healthcare providers assess the rheumatoid arthritis? The assessment starts with a thorough medical history and physical examination. Symptoms like joint pain, stiffness and swelling are common, especially if they persist for more than 6 weeks. Blood tests like rheumatoid factor and anti-CCP, the cyclic citrullineated peptide test, CCP, anti-CCP test, rheumatoid factor test, can help confirm rheumatoid arthritis along with imaging techniques like X-rays, ultrasounds or MRIs, magnetic resonance imaging, to detect the joint damage. Physical examination, thorough examination should be done to check whether there is joint tenderness, swelling, range of motion should be assessed. Is there any visible deformity due to which there is decrease in overall function? Then blood tests like elevated inflammatory markers such as rheumatoid factors and anti-CCP, which I just mentioned. Imaging studies, X-rays, MRIs, ultrasound, to visualize the joint damage and the inflammation. Okay. So, treatment for the rheumatoid arthritis is multidisciplinary. Many teams are involved here and it is aimed to manage the symptoms, reduce the inflammation and slow the disease progression. Common treatment includes medications like non-steroidal anti-inflammatory drugs, the NSAIDs, the corticosteroids and disease-modifying anti-rheumatic drugs. In some cases, biologics may be prescribed. So these treatments help control inflammation and prevent further damage, joint damage. So which I just mentioned, the medications. Physiotherapy I'll be completing further. Exercises is really important in rheumatoid arthritis, and the very last option, if the deformity is not in control, surgery is the only option. So joint replacements or other procedures to address the severe joint damage and improve function. Very important part of this topic, the role of physiotherapy in management. So physiotherapy plays a crucial role in managing rheumatoid arthritis. While medications address the inflammation, physiotherapy can help improve joint mobility, muscle strength and overall function. A physiotherapist can develop a customized exercise program to maintain flexibility and strength, which can help reduce pain and prevent joint deformity. So pain management, pain relief through modalities like heat therapy, cold therapy and manual therapies. Then joint protection, teaching patient to use joints effectively to minimize stress and prevent further damage. Exercise, strengthening muscles, improving range of motion and maintaining functional independence. Maintaining proper posture, proper routine, sleep cycle, diet, everything will play a very big and important role. So as a physiotherapist, you can plan the protocol as according to fit principle. Also we can do the warm-up period, main strengthening exercise, aerobic exercises, then cool down period. So in warm-up, head to toe warm-up exercises, mobility exercises we can do from head to toe, all the joint mobility exercises. Then in strengthening part, we can use the weights, we can strengthen major muscles. So first is maintaining proper range of motion. Then once the range of motion is achieved, maintained, work on the strengthening part, stretching part, and then the cool down period should be there. In cool down period, you can also give stretching exercises, do some meditation if required, breathing exercises. Everything should be done as the cool down period. So as a physiotherapist, a session should last 40 to 45 minutes. So some key techniques, as I mentioned, the range of motion exercises should be there, strengthening exercises, hydrotherapy like exercises in the warm water pool can relieve joint pain and promote relaxation without placing excess strain on the joints. Heat and cold therapy here, see, heat can relieve the muscle tension while the cold can reduce the inflammation and numb the pain. So likewise, we need to give the patient heat and cold therapy. Hydrotherapy can also work well here. So majorly we have to do, and we cannot stop the exercise. Anyone who is suffering from RA needs regular exercises. Once the patient knows all the exercises, he or she can continue, or under the guidance of physiotherapist, the exercises should be continued. Exercises, if not continued, may bring the patient to the original state which he or she was before starting the exercises or the physiotherapy. So I request everyone, or anyone who you all know, anyone from your family or friends who has rheumatoid arthritis, kindly provide this knowledge to them so that prevention is better than cure. So that's a wrap on the rheumatoid arthritis. It's a condition that can impact quality of life. I again repeat, it's a condition that can impact quality of life. But with the right approach, including the medical treatments and the physiotherapy, people with rheumatoid arthritis can manage their symptoms effectively. If you find this video helpful, don't forget to like, share and subscribe for more content like these. So also always leave your questions in the comment below if you have any, or share your experiences if you or someone you know living with rheumatoid arthritis. So thanks for watching and see you in the next video. God bless you all. Keep learning.